And Americans are not opposed to helping people in need, but not having it flaunted upon us. And then there are those who truly have a need and have no way to cover their health care costs. That is a much limited number, more limited number. Americans, by and large, would be willing to take care of that 12 to 15 million people, depending on who's estimating that. There are ways that it can be done. And that's what people are asking for. But to mandate it, and to mandate it on businesses to cover employees, under penalty, and under a penalty that either encourages businesses to say, I'll take the penalty, it'll be cheaper than trying to keep up with the cost that you're going to require me to put up. Or, okay, I'll pay for it, but I'm going to reduce the number of jobs. I've always felt that the best way to have health care coverage is to have a job. Because at the very least, you got an income to purchase it. If you don't have a job, what hope do you have? So those are concerns that we have in the bill. We could go through many more concerns on top of that. But tonight we want to hear your concerns. But before that, you need to know that I'm not just opposed. I'm not just anti. I'm not just saying repeal and replace. But you ought to expect that I have an alternative. Wouldn't you? Well, I did, and I offered that alternative when I was a member of Congress. It was put in committee. Speaker Pelosi left it in committee for almost a year and a half. It never saw the light of day. It offered alternatives for a patient-based healthcare system. Patient-based, what I mean by that, it says that the patient and the medical provider are the two most important people in the system. They ought to determine what's best for the patient. And in consultation, make that decision based upon what they need, the procedures available, the health of the individual, and the financial condition, whether it includes insurance or a straight pay. It ought to be the patient-centered approach. And so what I offered was a plan that did several things. One, it expanded the use and flexibility and the size of health savings accounts, so that you and I as individuals could take a portion of our income, put it into a health savings account as a tax-free benefit, and let that grow for our determination when we use it and for what we use it for. Make it more flexible, so you could even use that if you wanted to expand the type of health care coverage you have. Makes good sense to me. It's your health care pot of gold to be used. And if you don't use it, let it keep growing. So at a point in time, through the marvels of compounded interest, even in this century, or this decade, you can still see an expansion begin to take place. So expand health savings accounts. Two, give small business the same opportunity as huge corporations. Allow associated health plans so that small businesses can join together in economy of scale. A group of contractors, an association of contractors, or butchers, or sound technicians, or whatever, could get together and purchase health care coverage in an association at a reduced cost, because a larger number of people spreading the cost. We don't allow that now. I don't understand that. Give the same tax breaks to individuals who purchase health care coverage as you give to businesses. They're both being responsible. Seems to make good sense. Give them the same benefit. Another part of the plan was to say, let's allow ourselves to purchase health care coverage across state lines. I don't know how many of you have done research, but there are states that provide better coverage at a cheaper cost for oncology and senior issues. I've checked. Since I are one. It expands the competitive pool. It says to Michigan Blue Cross Blue Shield, it says to any of the other insurance companies, you can't hold us hostage in a state.